Hi Facebook world, Dr. Mankal here and my colleague Dr. Brown. We wanted to have a conversation today about different ways of adjusting the spine and removing pressure from the nervous system, because at the end of the day, if pressure doesn't come out, then the body cannot be restored to normal function. So some of the concerns we've had from patients over the years is that some people are afraid of chiropractic, thinking it may hurt them. And so there are different ways that have been developed over the years to be able to improve the movement of the spine and reduce nervous system pressure without some of the more hands-on approach that some people feel uncomfortable with and some people love. So we have different ways of being able to get that nervous system back to optimum health, Dr. Colin, I believe, yeah? One of them is the instrument that you're using. And what's it called?
This is the activator.
Activator. And it sounds like a clicker. People call it the clicker, I think, right? What does it sound like?
So it does make a noise.
Yeah.
It's spring-loaded.
So what I want to show you, just an example, it sounds like a clicker, which it is, but it puts a force into the spinal segment that's not moving properly. And just to kind of show you what it can do, if you can look down here, hopefully you can see this. Yeah, so there is a force and you feel a little bit of a pressure. It's about 100 times faster than our hands. We don't seem to hear the audible release from some of the manual work that we tend to do. So some people prefer that. But there are three main areas, Dr. Colin, I think, that we tend to use an instrument. What will those three types of areas be?
Right, so some people are just afraid of manual adjusting, but others legitimately need an activator. So the three areas would be more older patients, babies, and then people concerned about being adjusted manually.
Right. And older, maybe some people that we see, the geriatric folks, they may be osteoporotic, for example. Some already have certain spinal conditions that may not be best served with a hands-on approach, typically in that type of population. Obviously, we mentioned babies as well.
Right.
So how would you, if this was the spine of someone, like how would it be applied, for example?
Well, normally in a manual adjustment, we'd be working along the edge of the spine, and so replacing hand position with the position of the activator, and then the thrusting is in the direction of the joint.
Is it painful?
No.
It's not painful at all, right?
No.
No, exactly, right? Because babies get it, older folks get it, right?
Right.
And then, so that's called the activator. And then the other one that we tend to use, which I like a little better, it's a little bit more advanced, it's called an impulse instrument. It has three settings. The first setting is about 100 newtons of force. It sounds like a woodpecker, all right? And it has three settings based upon the spinal condition and the age of the patient. And again, very similar, it has a dual prong. So instead of only using one prong, we can actually get on there and actually affect both segments of the spine. So it makes it a little bit more efficient and a little bit more, I think the depth of thrust may be a bit more accurate for the individual. So those are the kinds of two different tools that we can use for people who are concerned about getting chiropractic. Because a lot of people that I think they suffer needlessly. I think they just wait too long, right? The damage happens in the spine, and they don't do anything, or at least seek chiropractic care because they think it's going to hurt. And I think these are two definite ways that we've used before with great success to really get people through a problem and they can get back to living their life again. So we hope that you found that a bit useful and to give you a bit of understanding of the different techniques that we tend to use. And I think especially people who are needing of chiropractic care but don't do it because they're afraid, we hope you find this of interest and you share it with your friends and family. Anything else you want to add, Dr. Colin?
It's a good option.
A fantastic option. So thanks for listening, guys, and we'll see you soon. Bye for now.